When we are young, we all think we are invincible, but teen injuries can lead to years of serious aches and pains.
Tendonitis, bursitis, muscle strains.
Accidents can happen during sporting events, but a lot of times teens just overwork themselves, playing and practicing sometimes more than one sport every day.
So we want sport participation. It's just when we take it to an extreme and we say that these kids can't take any time off of their sport, that we're running the risk of major injury, number one. Number two, psychological damage. A kid can get burned out from participating in a sport all the time and not having any downtime.
The safety rules are also different depending on sporting organizations. For example, limitations on practice time in summer heat vary.
My opinion is that the TSSAA should follow the policies of the NC2A. And this is the governing body for all of college sports, and they say how many practices a day they're allowed to have the first 5 days of practice. They make recommendations regarding heat index, and yet in the state of Tennessee we do not have those kind of protections for our children.
Some clubs don't even use an athletic trainer.
And athletic trainers are the first line of defense as far as sports medicine goes. They're the people who are attending practices, they're talking to the athletes, develop relationships with athletes that go far deeper than anything a doctor or a physical therapist or other specialist could develop.
If the athletic trainer feels there is a problem, a visit to a sports medicine doctor is highly recommended. And that does not mean surgery will be necessary.
Yeah, I would say that about 70 to 80% of what we see as sports medicine conditions don't require an operation. So that means there are a lot of things that we can do short of surgery with medication, with the right rehabilitation program, and that's where physical therapists come into the picture.
Olympic gold medalist Michael Phelps even has a sports medicine doctor on his staff. The most important thing for young athletes and their parents is to pay attention to even the smallest thing, like back pain.
Especially people who participate in sports where they back bend. Gymnasts, cheerleaders, competitive cheerleaders who do a lot of tumbling, interior linemen on the football teams in middle school and the first couple of years of high school, they're more at risk for developing fractures of the back. And if these aren't recognized early on, treated properly, they can go on to not only have a fracture, but a fracture and slip of the vertebrae that's permanent.
So need to be aware that the pain of the injury can go a lot deeper and lead to other problems.
There was a research study that was done years ago about stress indicators in adolescents, healthy adolescents, and there was a subset of this healthy population that were far different in how they ranked certain stressful events, and that was athletes. The adolescent athlete will rank failure to make a sports team higher in stress than the death of a close friend, higher in stress than failing an entire year in school, and higher in stress than the separation of his or her parents.
Participation in sports can be fun, but it is also a huge commitment for both the student and parents to make sure they are getting the right kind of care.